hormone which stimulates, which causes endometrial cancer is estrogen. But what I feel is at least ultrasound should be enforced in one of the screening protocols.
So, what is the age of incidence and how do these cancers, present in our Indian women?
Over the board, if you take the age of cancers for breast, endometrium and colorectal is 60 and above. Whereas if you take cervix cancer, it is around 40.
Patients come to you at an early stage, or even for endometrial cancer, do they come at late stages? How is the scenario?
Yeah. There is actually no screening protocol per se for endometrium and ovary. So if you take for any screening protocol, it should be cheap.
Doctor, do you think there is any link between gut health and cancer?
So there is actually an axis. So basically the lactobacillus, all that comes in a good bacteria. So basically the estrogen, what happens is it is actually deconjugated.
Welcome to Feminine Systems, the podcast where we not only heal and empower women, but also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author and an entrepreneur. Today's topic is very interesting and we have a very special guest. To talk about the unspoken truths of female cancers, we have a very special guest, Dr. Praveen Ravishankaran, who is a surgical oncologist and a laparoscopic and robotic surgeon at GKNM Hospital, Coimbatore. Dr. Praveen graduated from Adair Cancer Institute with a gold medal and has published various papers in the national and international journals. His commitment to serving the poor made him work for 3 years in a small town in Assam under Dr. Ravi Kannan, who was a Padma Shri and a Ramon Magsaysay awardee. He also runs a non-profitable organization called Beacon of Hope Cancer Foundation to help the poor patients. He handles laparoscopy and robotic surgery at ease. We welcome you, Dr. Praveen. Welcome to our Feminine Systems podcast. Let me go to the questions directly, Doctor. Yeah. What are the commonest cancers in Indian women?
The commonest actually cancers in Indian women, if you take the urban population, is mostly breast cancer.
Okay.
And followed by endometrial cancer and colorectal cancer. Whereas if you take the rural population, it's even now it's cervix cancer. Cervical cancer is the most common cancer.
Okay. So what is the age of incidence and how do these cancers, present in our Indian women?
Over the board, if you take the age of cancers for breast, endometrium and colorectal is 60 and above. Whereas if you take cervix cancer, it is around 40 years of age. So the most common cancer, as I said, was breast cancer. Breast has a little earlier age of presentation. So if you take, it's around 55-60 years. Whereas if you take endometrial cancers, it is around 65 to 70. But now, in my practice, what I'm seeing now is that most of the cancers come approximately a decade earlier than what used to.
Yeah, I also heard because there has been this 30 to 40 year age group, there are more breast cancers which we are seeing currently, right?
Lot of breast cancers and lot of ovarian cancers.
Ovarian too? Okay.
Lot of ovarian cancers, because before this I actually finished my graduation from Adair Cancer Hospital. So when I was doing my post-graduation, ovary cancers, mostly I used to see around 60 years, 65 years.
And very old age, literally old age, right?
Very old. But now more than 50 to 60% of the patients I'm operate are around 35 years of age, which is shocking. And especially if those cancers come at that age group, they are highly aggressive.
Correct.
And the stage is usually stage 3, sometimes even stage 4, unfortunately.
So what is likely a reason for such a shift in the age group?
I basically think it must be the environmental factors. Because most of the things that we do is not organic. If you see the food, like whatever food we consume is all packed food.
Correct.
Yeah.
Ultra processed.
Yeah, and we use like chemicals left and right.
Yeah.
So all those must be the reason for that. So the more we use, more there is mutation of the
Correct.
genes, all that. There is more of pollution also, unlike before.
Yeah. Very true.
So more of mutations keep adding up.
So we subject ourselves to a lot of cellular injury, basically.
Yeah, yeah.
Right.
Yeah.
So with all these toxins from outside.
Exactly.
How does endometrial cancer present?
The most common presentation is postmenopausal bleeding. So it usually occurs at the age group of more than 60 years. And any lady who has postmenopausal bleeding, the first diagnosis is carcinoma endometrium.
If it happens in a much younger women, so usually what happens is, as a gynecologist, we get patients who are having an abnormal uterine bleeding. So there is like, menorrhagia, like they can bleed for a very long time and all that. So if patients are worried, like if this is cancer, so if it is presenting in an earlier age, how do you diagnose it?
Yeah, so usually if the easier thing is postmenopausal ladies, the endometrial thickness, if it is more than 4 millimeters. So this is basically done by transvaginal ultrasound, where they see the endometrial thickness. If it is more than 4 millimeters in thickness, then we have to do a biopsy.
Yeah, for people who are
postmenopausal.
Yeah.
Like suppose if you take a premenopausal or a perimenopausal lady, sometimes the endometrial thickness will be around like 10 to 13 mm. So in that case, you need to do an MRI or somewhere and then see if there is a mass. Yeah, so especially in young ladies, you need to have a high index of suspicion. It is not easy to diagnose.
Okay.
Yeah, because there are a lot of reasons why you can have bleeding.
Absolutely.
Dysfunctional uterine bleeding, fibroids, all those things. Yeah.
And so ideally, if the ultrasound is done in the follicular phase, especially after a bleed, that is the right time to see, and that endometrial thickness is, as you said, more.
Correct.
Then we kind of have a suspicion, go for a fractional curettage, or then go for a MRI.
But generally, it is very low. The incidence of endometrial cancers in age less than 50 years is very less.
Very less. Okay. So, do you think there is a link between obesity and endometrial cancer?
There is a definite link between obesity and endometrial cancers. Most of the ladies who come with endometrial cancers have obesity.
What is the reason why obesity is linked to endometrial cancer?
The basic reason is because of inflammation. Obesity itself causes a lot of inflammation in your body.
It's an inflammatory state.
It is an inflammatory state.
Yeah.
And actually, I would say if you take endometrial cancer, the main hormone which causes endometrial cancer is estrogen. So if you take postmenopausal ladies, especially if they are obese, those ladies have a lot of fat storage.
Correct.
These fat storage actually changes androgens into estrogen, aromatization, and there is a lot of estrogen in these ladies, which in turn causes endometrial cancers.
Correct.
So that is one factor. The second factor is because of inflammation. Yeah, so these fat basically secretes inflammatory cytokines, like tumor necrosis factor, alpha, interleukin 6. All those actually causes tumorigenesis, increases the chances of you getting tumor. So obesity directly correlates with CA endometrium. Most of the
cancers, that's why, right?
Most of the cancers, correct.
Breast, endometrium,
correct.
Even colorectal, right? Like most cancers, we have a strong association.
It is known to cause around 14 varieties of cancers, actually.
Okay.
Yeah.
Okay. No, I see, as you said, postmenopausal bleeding is an important sign. That means after menopause, if somebody's after a couple of years, they have a bleeding, you call it postmenopausal bleeding, and that is a first sign of an endometrial cancer. Do you see patients come to you at an early stage, or even for endometrial cancer, do they come at late stages? How is the scenario?
Yeah. CA endometrium is actually a very good disease. So suppose what I feel is if any lady unfortunately has to develop any cancer for that matter, CA endometrium is the best, because most of the ladies initially develop some amount of bleeding, spotting, and once they see that, they become very scared.
The alarm rings. Very
alarm rings. It's a red flag, and they come immediately to the doctor, and we do a biopsy and we get the diagnosis as CA endometrium.
So they come to you at an early stage?
Yeah.
Okay.
Around 90 to 95% of the ladies come at stage 1. So which is very good as far as endometrium is concerned. Whereas the same thing is inverse for ovary. Most of the ladies come at what to say, stage 3 or stage 4 disease. 80%.
Yeah.
Very rare ladies come in the stage 1 or stage 2.
Because it's so asymptomatic.
It is so asymptomatic. There is no red flags.
Yeah.
Your abdomen just keeps bloating and you will think you're putting on weight.
That looks like very normal aging for me.
Exactly.
And the perimenopausal changes, the hormones are fluctuating and that makes you actually have normal bloating.
Exactly.
So we consider it like that and we kind of ignore it.
Mm.
And naturally insulin resistance increases in perimenopause and that also makes that bloating more significant.
Yeah.
So we kind of push it aside. They come very late. Is there a role for routine, a transvaginal or an abdominal ultrasound itself for people above 40? Yeah. If you do think they have to undergo something regularly?
Yeah. There is actually no screening protocol per se for endometrium and ovary. So if you take for any screening protocol, it should be cheap. It should be universally, we should be able to apply it over the board.
Correct.
But the problem is for endometrium and ovary, there is nothing like that. But what I feel is at least ultrasound should be enforced in one of the screening protocols.
Yeah.
Abdominal ultrasound at least over the age of 40 years. And those ladies who are having a higher risk.
Yeah, like family history,
right? Mutations possibly.
Right.
All those ladies should have
and
ultrasound
if you're maybe
abdomen.
obese. And I think these are diseases of the, like, as you said, urban versus rural. The urban population is more predisposing to breast cancers, endometrium and all. So if the affluence actually also can have a significant...
Yeah.
So maybe they can have a, kind of have reinforced for themselves that go have an ultrasound couple of years once, at least 2-3 years once somewhere, 2 years once something.
There is no strict guidelines and especially it is very difficult to implement that in India per se.
Right.
Where ladies kind of postpone the things, they have family issues and all that.
You won't believe, there was a patient for me where she was having a borderline, a young patient, around 40. Okay. So she was having a borderline ovarian cyst, which was like, the MR was, everything was borderline. Okay. Everything was borderline for her. Even CA, 125, everything. So it was around 10 to 11 centimeters as well. She has been postponing her surgery for 1.5 years. They were taking some naturopathy medications and whatever, so that the cyst will reduce in size. And with multiple, they changed doctors. I also went through everything and I just said, just remove it. It could just, since it's borderline, that means it is still, we can have, at least just get it done. Such a big... Leave apart that there is the risk of torsion, rupture, and all that.
Exactly, 10 to 15 centimeters.
Educated, very well educated. They postponed it. Eventually, it turned out to be a dermoid.
Thankfully.
But after 1.5 years. So this is the scenario we're talking about in the Indian context sometimes, right? There's many
urban population
very
also.
Very educated. They've returned from US.
Then just imagine the rural population.
They lived, worked there.
Yeah.
Right? So still... Doctor, do you think there is any link between gut health and cancer?
Yeah. So there is actually an axis which is called the gut, estrogen and cancer axis. So if you take the gut, so like basically the gut control, it is called the second brain.
Yeah.
Yeah. So if you take the gut, it has good bacteria and bad bacteria. So basically the lactobacillus, all that comes in the good bacteria, Clostridium,
E. coli.
E. coli, all that comes in bad bacteria. So basically the estrogen, what happens is it is actually deconjugated by these bad bacteria and it is actually sent into the bloodstream and the level of estrogen basically increases. So this actually causes cancer especially, and so this axis is one of the reason, and one more reason is because of inflammation. So actually bad bacteria also causes gut inflammation.
Yeah.
So there is a full cascade of events that occurs, especially as far as gut is concerned.
Exactly.
Yeah.
So that estroblome and all that, right? It's a gut microbiome which converts this. And this also results in a leaky gut, what we say, right? Like this is what pushes all these postbiotics into the bloodstream, which if at all they are molecules which actually affect these trigger these inflammatory markers again. So it's, as you said rightly, people don't give so much importance to this because of eating actually matters a lot to our cancer development.
Like whatever food we take is all inflammatory. If you take maida, all the packaged foods. So what I feel is when we're going into a like supermarket, we have to divide the supermarket into 3 divisions. So one division is all fruits, vegetables and all that, but generally, basically we ignore. And second division is all like what cereals, pulses, which we need in our day-to-day life. The third is all the packaged items. We directly go to the packaged items.
They're tasty.
Yeah, they're tasty.
They're looking attractive packagings.
Exactly.
They come in. So,
all those are cancer causing.
Right.
Basically,
so,
if you see.
No, yeah, the purchase itself is like we have gone to those kind of foods. And many assume these cancers are basically it's some God-given or genetic or it is fate. When they fail to realize it's a daily, something what we actually do is everyday eating.
Yeah.
So this can really help sometimes reduce the risk of having a cancer, because and since our longevity is actually increased, all of us in this current environment are at a risk of developing cancer at some point.
Exactly.
I always think if living in this planet for long,
no, that's a scary thought,
right?
actually.
Living in this planet for quite long, you are at a pushing yourself to develop some form of cancer. But if you can delay it, or can you delay the happening, or can you diagnose it earlier? So that is where we want to bring this podcast into, create awareness. So how eating is important, and anti-inflammatory diet is important, and early screening. So is there any role for any early screening in these cancers for women?
Yeah, so like actually breast, if you take, it is established. So beyond the age of 50 years, annual mammogram is very important.
Isn't it 40? No?
Like 40 if the lady has any high risk and all those things.
Okay.
40 to 49. If it is 50 and above, it is annual mammogram.
Okay.
Sometimes, yeah. So that is for breast.
If there's a family history of cancer?
Then if there is a family history of cancer, then you have to do it 1 decade earlier than the index case.
Okay.
So suppose if there is someone in your family who has breast cancer at the age of 40, then you have to start screening from the age of 30 years.
Okay. And this family member should be a mother or a sister?
Yeah.
Yeah.
First or second degree relative.
Okay. Even aunt is okay. Mother, sister.
Correct.
All right. Okay.
Take for cervix cancer, it is already established pap smear.
Yeah.
Or HPV assays.
Yeah.
High risk HPV
our previous
assays.
episodes where we've had a detailed talk about cancer cervix, HPV vaccines.
Okay.
And we did slightly touch on the breast cancer.
Okay.
So the other cancers of women, we've really we're discussing it with you. Period pain versus colon involvement. How to discern?
So period pain and colon involvement can be drastically different. Like colon pain depends on where you're having the pain. Like whether it's a right-sided cancer or whether it's a left-sided cancer. Period pain may be a diffuse hypogastric pain, lower abdominal pain. It will not be associated with any bowel symptoms. You will not have any constipation or diarrhea, and you will not have any bleeding per rectum. So those cases, like maybe because of any pelvic or uterine pathology, if you have bleeding PR, or if you're having drastic weight loss, alternating constipation, and diarrhea, those cases point towards colonic malignancy.
Okay. Is there a role for preventive salpingectomy in cases with family history of ovarian cancers?
Yeah, like approximately 15% of the cases, all cancers are genetic. So if you take, like there is a mutation called BRCA mutation, BRCA mutation, which causes breast and ovary cancers. So suppose if you have like BRCA mutation, you have a chance of around 20 to 30% of developing ovarian cancers. The chance of you developing breast cancer is around 50 to 60%. So in those ladies,
consider prophylactic
salpingo-oophorectomy.
Okay. Salpingectomy alone or salpingo-oophorectomy?
Salpingo-oophorectomy is better. Yeah.
So because they even say, most of us, we have been taught that this tubes, salpingectomy means it is the removal of the tubes.
Yeah.
Salpingo-oophorectomy is removal of tubes and ovaries.
Yeah.
So this salpingectomy is sometimes because the tubes are a nodal of bringing in toxins which are actually stimulating repeated infections, right? That hydrosalpinx, when there's PID and all, it can increase an inflammatory environment in the pelvis. So how does silence and stigma affect diagnosis of cancers in women?
We see that very often, especially in women, where they actually prefer to stay at home and actually wait it out unless they have severe pain and then they come. So most of the ladies are actually diagnosed at a later age group. And what I find in my practice is, if I'm going to operate 10 cancer patients, around 6 to 7 patients are actually ladies. So the incidence of cancer is also, I feel, higher, becoming higher in ladies as such.
Okay. And probably men are, if there's a chest pain, even just a chest pain, the entire family rushes to the hospital quickly. But
Ladies,
if there is if there's a woman who's just complaining of some, as you said, bloating, they don't reach out. Vaginal discharge for cancer cervix.
Exactly.
Right? This is something people just suppress it. They just feel shameful or not wanting to discuss, and they just they're learned to endure things. I think we, as a society and culture, we have taught and imposed that on women. Okay, so the enduring is more strength.
I have one more thing is one personal family member of mine. So she had vaginal discharge, like how you said, for around 1 year. Then she did not tell us. We were 2 doctors in the family. They didn't tell us. But ultimately, when it was diagnosed, it was like stage 3, CS cervix with a large node. Then she had to undergo like multiple lines of treatment.
Yeah.
So the stigma is actually a very difficult thing to manage. Even in the urban population in India.
Very true, because nobody talks about it, because we just, one side the medical care is focused on treatment when you come, because making the patient come for an early stage. And if a cancer is diagnosed at an earlier stage, the treatment outcomes are better.
Exactly.
The prognosis is better. Let's say some cancers start with only we need surgery at all. We need not add an additional radiotherapy
True.
and chemotherapy. According to you, how much of quality of life difference does adding or not adding a chemo radio in case of treatment of cancer is? Can you tell me a little more about the side effects and the complications because of that?
So according to my personal experience, any cancer requires 3 treatments: surgery, radiation, and chemotherapy. Among these 3 things, surgery is the easiest. All of them are scared about surgery because it is painful.
Absolutely.
And all that. So
it's a mind-blowing revelation for me now. Because people are scared of surgery,
exactly.
right? As though surgery is done as when somebody is awake and you're aware of your pain and all that. But this radiotherapy and chemotherapy,
they have long-term complications.
Exactly.
Actually, it is painless, but the thing is the complications are long-term. Whereas the same thing, if you take surgery, pain is initial.
Couple of days.
Yeah, that's all. After that, you will be free of pain. You can go back to work.
Absolutely.
And especially if you have an early disease, surgery alone is enough.
Correct.
That is the best.
So what are the complications of radiotherapy for these cancers in the abdomen and genitals, pelvic region?
So suppose if you give radiation for the cervix, so actually in that area we have the bladder and the rectum. So that can result in radiation proctitis and
cystitis.
Yeah.
So how do they present actually? It is like they have difficulty in...
So these patients will have long-term burning micturition. They'll have bleeding per rectum. So you'll have to keep on actually, I would say, keeping steroid enemas and things like that. This was a personal experience from my own family actually.
Yeah, I've also seen some close family member who went through this.
Yeah.
For long they don't, they just... And women who wear saris somehow... somehow they are not realizing. I find that people who are into the Western clothes or salwars, they're able to pick. This is something I don't know. It's like I note that observation because they think the moisture is totally because of the clothing itself, the discharge, right?
Okay.
And it gets spread with a lot of clothing. There are many layers of clothing wrapped around, right?
Okay.
So. But if it is the other ways, it is easily the smell is if it's a foul smelling discharge or something, it's very hard, it hits your nose very quickly. So this is something what I've also realized. the discharge doesn't even show it on these clothing. So when multiple layers are there, right? So it's some deeper observation. But
Seriously.
there is nothing like, we have a statistically proven thing, but just
it's important. Even observations are important in our practice. So, not everything can be proven by studies.
And we don't have to invest so much to just make a study out of this, right?
True.
So if you can redesign screening, right? How would you structure it?
So basically, what I would like to add is some metabolic parameters like insulin level,
correct,
and beta globulins, all those things. And apart from that, CRP, inflammatory markers, add that. And along with that, ultrasound abdomen, it should be indispensable as far as I feel. Transvaginal ultrasound is very useful.
Very, very useful.
Very
right,
useful. All this can be added.
Correct. And I also even thought one simple thing that most women don't keep track of their menstrual pattern. So I think having a menstrual log, it really helps. You actually, it breaks down so much information to the person, we ourselves. So something that also can be added is always, I thought.
And the next level is checking your gut, seeing your gut bacteria, about the small things in guts. We have not reached that level.
Right.
Yeah,
like
I hope
we call it as microbiome mapping,
exactly,
right?
microbiome mapping. Yeah.
So I think the future is there, but we are yet to. I think that plays a very significant role. In one of my podcasts, I did speak about how much of bacteria we are harboring, the bacterial cells we are harboring. So definitely, it outweighs the human cells.
Exactly. True.
And the best part is, see, only 1 to 2% is the organ cells of what human cells we have is organ cells, and the rest are all those RBCs and things, which again the churn is every 3 months we lose. These organ cells also, there is a churn which is once in 10 years. So actually we are more of a bacteria most of the time.
This is a good thought. I've never thought about that.
Yeah, because only 1 to 2%, all your neuroglial cells or your whatever muscles, everything, every other cell is only 1 to 2%. The rest are RBCs, WBCs, platelets, and that. So 98% of human cells is this, and which platelets get removed from our body in 10 days or something. Yeah, and this RBCs 120 days. So literally new cells are being produced. So what constitutes human? It's 1 to 2% of the human cells we are, and they are almost the number of cells, and the genetic material is very high. We are only like some 20,000 genes, right? They are more genes. It's millions of genes we are harboring. So it's very important that and I also read the cancer risk again, that's a very strong mitochondrial dysfunction also. So
this is like next level thinking actually.
Okay, so no, I was like, it is I just think it from a very let's say cultural standpoint, where we had a lot of practices, ancient practices and traditional wisdom, which actually without much scientific research like the Western world, we did certain things to take care of a microbiome like anything. We had a system to do that, and probably that's why people mostly died of infection more than all these cancers, even if they lived long, right? Like so in those previous, and now of course now we are doing all large scale commercial farming and breeding and all that. So just
if you see around 50% of my patients are farmers.
Okay.
So they come and tell what is the reason for that is because they handle fertilizers, pesticides with their bare hands, and that gets absorbed into their system. What they say is if we go and see the way they are farming, we will not eat food, because they use so much of pesticides and insecticides to get a bigger yield. That's really difficult.
This is very scary, because as doctors we again say, eat a lot of fruits and vegetables.
Exactly.
Right? And that is a real protective thing. But at the same time, they are also loaded with pesticides, right?
Yeah.
So somewhere it's a tough thing, basically. I think we need to have a much efficient detoxification mechanism in our body. You need to tune into that, where like to quote, for instance, there is like one of those in the epics, the Lord Krishna can, can eat swallow anything, like even or I think
Universe.
not Lord Krishna, I think Shiva or something. I'm not sure. They can drink the venom.
Okay.
They turn blue because of the venom,
Okay.
and it stops here. So I think we should have a strong detox mechanism about, because it's not the same way when two people consume the same thing, right?
Okay.
So probably the relationship with our microbiome might make the differences.
True,
Is
definitely.
my
Something
strong
that can
belief.
detoxify whatever you take it.
Because that is your partner in crime. So it is like they form a major stakeholder of your system. So probably you have a good relationship with it. It kind of manages and adopts to detoxify everything.
It's a good thought.
Okay, so and I wanted to ask you. So how does, if I have got cancer,
Yeah.
I have too many doctors to consult. So there is like most of the time they come to the gynecologist, because being a woman, especially I'm talking more about women. So the podcast is themed around women-centric topics, basically.
Okay.
So they come to a gynecologist. So how does today, because the surgery which was once open surgeries evolved to laparoscopy. Now the advent of robotic surgery.
Yeah.
And these all surgeries of ovary, endometrium, cervix. When I did my UG and post-graduation, there was a slight preference for an open surgery for open worthams, which was slightly superior at that point, because it gave a good clearance. The nodal dissection was better. But once after a couple of years, the studies have proved laparoscopy is equally effective. Now with robotics, how does a normal person make a choice between these three? So based on your stage, and like, how do you opt?
So basically what I feel is all cancer surgeries, it's like an all or none phenomenon. The first treatment that you do, first surgery should be done well. So whether it be open, lap or robotic.
Okay.
So the difference between lap and robotic comes under minimal invasive. So the difference between that and open is that we use small incisions. And using those small incisions, we complete the surgery. I'm in charge for robotic actually. So if you take robotic surgery, we have what we use in my hospital, GKNM Cancer Hospital, we have the Da Vinci Xi. And so that is among the best robots available in the world at present. So the vision we actually get with that is 3D vision, and there is a 10x zoom. And so we can see each and every organs, each and every nodes properly. And the dissection that we do is also, marvelous. It's really good. And one thing I've observed is both in robotic lab, more so in, I feel robotic, patient does not have that much pain at all.
Right.
Immediately after surgery, maximum they require is paracetamol, that's all.
Such a long incision we give for a verdict.
Exactly.
The retractors we put, and I used to get scared. I used to always, whenever I used to, assist the worthams, I always used to feel, what if I get one?
No, you shouldn't.
It used to be like that scary kind of thing. One was that. But now it is like, which among the three is more effective according to you?
Yeah, so in this, if you see in this point, I would like to differentiate CA cervix. For CA cervix, we do a worthy cystectomy. For that, we do only open. We don't do lap and robotic. Because we have a recent paper which shows that lap and robotic is actually, it actually decreases survival when compared to open. Whereas if you take like other cancers, for example, endometrium, I feel robotic is or lap is much better than open, because the incision is very small.
Absolutely.
And then patient discharges also in hardly 2 days, and they can go back to work within a week. Whereas if you do an open surgery, they may develop other complications like hernia, burst abdomen, and they will have significant pain also.
Correct. Here I want to make sure people assume today in this AI world, this robotic surgery means they assume there's a robot coming and doing surgery, right?
Yeah, that's a myth.
It's a misnomer actually, robotic surgery itself, right? So how does the surgery happen? Just because people want to understand that, right? So
so actually what we say is a robot is not a robot. So the real word is called master-slave manipulator.
Okay.
So here there is actually a master, and then there is a slave, which is actually the robot, and the master manipulates the slave so that the surgery can be done.
Okay.
So everything depends on the surgeon. So if you take in a robot that we have 3 parts. So one is a surgeon console where the surgeon sits and operates, and another is a
Right.
patient cart where the patient is there, and there are 4 arms of the robot where the instruments are attached. And the surgeon from the console uses joysticks so that the arms move inside the patient's abdomen in a precise movement, and the surgery is done. And then we have a vision cart, which is a 3D vision.
So eventually the surgery is done by the surgeon.
Surgery is done by the surgeon.
You know, the view,
Yeah.
the dissection is
Exactly.
amplified and supported by, because it is
By
deep
the
down when you
instrument.
go in the pelvis,
Yeah.
it is, it's all covered
Yeah.
with bowel and everything.
Exactly.
So to get a good vision, so
Yeah.
this aids.
The vision is very good, unparalleled, and all the instruments that we use in a robot are very long. It is 50 centimeters long, and the reach is much better.
If you have to pick between lap or robotic, which
Yeah.
would be your personal choice?
I would pick robotic actually, and especially going now. Are things about women cancer, see endometrium basically, and is one of the most common cancers, and one of the most common cause of endometrium is obesity. And all those ladies who come, their BMI is basically 30 and above. So in those cases especially, robot has a very good advantage because we can reach deep down into the pelvis.
Correct.
We have good instruments to manipulate.
Correct.
Those ladies, I prefer robotic. Recently, we operated a lady.
Laparoscopy actually demands a lot of surgical skill also, and it is very difficult in an obese patient, and it's a lot of strain on the surgeon too, right?
Exactly. We need to stand and operate. And one more thing is we have to depend on the assistant to operate the camera.
Exactly.
Whereas here, we manage the camera in robotic.
No,
That makes a world of a
assistant
difference.
actually has to have the knowledge like a surgeon or be equivalent. So these are the factors again, practically, which makes and it justifies the cost also.
So cost in the long run can be justified. Actually, the patient goes home early. So
For robotic itself. No,
for robotic. Whereas
even
open,
with laparoscopy, I'm saying the cost.
it'll be around 2 days extra. So basically, if any patient comes to me, I offer a choice. I don't force them. And if they're willing, I offer them robotic.
Okay.
Because I do both. But for a surgeon who does only open and robotic, then they don't have a choice.
Right. So, okay. This is very important. Like, there was a very big issue about the talcum powder use in the genital area. Like, a big scam of a well-known baby talcum powder brand. And its association with causing ovarian cancers and others. So what is your thought about it? Because there were now the incidents have come down. Most people are known to put talcum powder for the baby after a bath, and especially in the genital area and all that. So what is the association of talcum powder with the cancer incidence?
So it has been proven by studies that talcum powder causes ovarian cancer. So what I feel is it should be avoided. Yeah. And I feel many companies have actually been banned in US, where it's very stringent not to use talcum powder, especially in genital areas.
Yeah, probably they
Migration.
say talc is basically a mineral.
Mineral.
Yeah, and they say it is all contaminated with asbestos, which is a proven carcinogen.
Okay.
And very importantly, then these parabens, phthalates,
Which
many
used in
other
cosmetics.
solvents, right? Like they used in cosmetics, deodorants, perfumes, and actually companies are not mandated to disclose all that they're using. It's not very well regulated also, in my opinion. So these are also hormone disruptors basically. So they are applied on your skin. So whatever clean label certification, I mean, they claim to be, I'm very skeptical personally. So in my opinion, after a certain age, beauty is, in the person we are basically, right? Like I think more, the younger age group, I can't talk this, but if you've abused yourself all the while till, you're 40, 50, I think after that at least we could just maybe try to expose ourselves lesser. It's a very personal choice, which I feel it's not like completely avoided. Maybe at least not on a daily basis do we need. I used to always wonder, why do we have to daily use a perfume? Why do we have to daily use a lipstick?
True.
These things, they are it can. So this is something a very personal thought, but definitely I've seen, because there was a study, the 2004 UK study, which says like around 99% of the breast cancer after that biopsy samples, they were able to detect these parabens and all. So how did they go in breast cancer? So we use the use sprays and all that, right? Like every day it has been like used, and it has been absorbed in the tissue. So much it gets deposited there, and it's not excreted, it's not out of your body, right? True. So somewhere it can have a role. So it's not proven so strongly, but maybe
you cannot prove all these things. Many things cannot be proven. But it's better to avoid all chemicals.
Right.
One of the reason I'm not applying a hair dye is because of that. Because hair dye is known to cause many cancers like blood cancer and then bladder cancers also. It's better to avoid that.
I know this, but it is today we are so obsessed with beauty and looks, right? So obsessed. No,
especially with the Korean thing coming inside.
Yeah,
where it really matters.
I know that is. I think there are some times when I felt, running a spa is more profitable, or a salon is more profitable, right? Because the amount of newer chemicals we are applying on our skins, it's incredible. So
we apply chemicals, we take in chemicals.
It is too much. And see, it is not. It has a role in this endocrine axis, neuroendocrine axis of us. It has, when that is disrupted, when that calm is disrupted, I think your body is always under a chronic inflammatory state.
True. Yeah.
That also, like stress, you say, like everything. It all adds. People who suffer, I find that because they have this CRP levels very high, and they are more prone for developing some cancer, whichever area which is vulnerable. Let's say cancer cervix, the trigger is definitely an infection. But your immune system plays a big role. Definitely. Everybody is almost infected with a HPV virus, right?
100%.
Right? But not everybody gets a cancer cervix, right? So this is something I wanted to even. So we are almost nearing our discussion. My favorite area is the rapid fire round in the Feminine Systems podcast, basically, because we try to squeeze in all the important ones, and concisely we kind of add to it. So most underdiagnosed symptom in endometrial cancer.
Most underdiagnosed is postmenopausal bleeding, basically. Any lady who has bleeding should come. Basically, they don't. They just think only once bleed, we'll leave it. We'll go after the next cycle. Next cycle may come after 2-3 months. By the time the cancer will be growing inside, it may metastasize. So
many people, I want you to understand, we call menopause as something where 12 consecutive months you don't have periods, you are in menopause. It has hit you. And after that, any bleeding is a concern. That is what we are talking about, postmenopausal bleeding. So that is an alarm, even if it is once. For past 1 year, 1.5 years, I didn't get periods. Suddenly, I had once bleeding. Don't think it is okay, may another regular period. Just go and get it checked and rule out cancer. That could be a very important. Most misattributed sign in ovarian cancer.
Most misattributed maybe bloating. Generally, all of them correlate bloating with indigestion,
gas,
whether they've taken gas, exactly.
One test every 35 plus women should ask for.
Ultrasound abdomen, I feel so. And CA breast, if they're more than 40, family history, maybe a mammogram, but ultrasound abdomen is very important. Helps you rule out a lot of things.
Mammogram every year increases risk of cancer because of radiation exposure. True or false?
Huge myth. The amount of radiation that is given with mammogram is very, very minuscule. That will not cause cancer.
It's even lesser than an X-ray chest.
Much lesser, lesser, 100 times less, more than 100 times lesser. So you can go ahead and take a mammogram.
Every year is also fine.
Definitely, you should.
Is period tracking a cancer screening tool?
Period tracking, like how you said previously, it should be added in the protocol.
Bigger threat, ignorance or delay?
Delay, definitely. And if the patient has an added ignorance, then it's very difficult, because unless
and they go back also after coming to treatment. That is even worse, right? Oh my
God. Your eyes
does
not see what the mind does not know. So you have to have some awareness of what you have to diagnose Once you found there is some red flag, better not delay.
Sausages, ham, bacon are carcinogenic or not?
100% carcinogenic. It has been proven that any red meat causes colorectal cancers.
And they're processed meats.
They are processed meats, much processed, highly inflammatory, better not to take.
Your take on alcohol and cancer?
Alcohol is one of the modifiable risk factors. It is known to cause at least 10% of all modifiable cancers. So you can take alcohol, but up to a certain limit. And that limit has already been, I think, predetermined, how much you have to take. And it varies for men and women. Men can take more than women.
Absolutely.
Exactly.
Yeah, the metabolism. Two things. One, the fat percentage is more for women. The liver enzymes, again, detoxification, what generally happens or excretion of everything, is
lesser in women.
Yeah, it's very lesser. So women, if the same amount of alcohol what a man takes, they'll be more at a higher risk of developing a cirrhosis, an alcoholic liver cirrhosis. So these two reasons are so literally it's almost half the quantity, I suppose.
Exactly.
Yeah, but
exactly
now women also
half.
drink equally like men, no? Or sometimes more
they
than
want
because
equal in everything.
And binge drinking actually increases this risk.
Okay.
So it is worse than the number of times somebody has a drink. Binge drinking is worse.
Okay.
So, and I think women are known for stickler shots and binge drinking more. So
it's more of a style statement now.
Exactly.
Shots.
I see, whatever is sold to you, which is like such a cool thing to do, is carcinogenic.
Carcinogenic, yeah.
Let's say cool thing to eat is a processed breakfast cereal.
Yeah, exactly. Cereal, exactly.
Processed breakfast cereal, which is sugar, which is ultra processed.
Yeah.
Right? Cool thing. Do all the cosmetics on you, cool thing. Right? So again, alcohol, right? Yeah. Like now it's we meet, we have to have a drink. So then you're actually exposing yourself to more often these substances.
More amount of sugar you take, there is more amount of insulin spikes. And more amount of insulin spikes, there is more of inflammatory hormones that are secreted. So if you avoid sugar, that's the best thing that you can do, which is very difficult, as you say.
I know. There's just all the items that have, I don't know, most men don't cook, so they might not really know. Even breads, anything, you make a sauce, everything. There are gravies where sugar is added. Sugar need not be that white sugar, even jaggery or honey or maple syrup. Pancakes, added sugar. Waffles, added sugar. Any bread, right? Bread, there is the yeast to be, with yeast you add sugar and water, lukewarm water. Okay. At least 1 spoon has to be added. The Indian cooking is better because we at least don't add this added sugar. Every other form, right? If you make a pasta, every sauce, everything has added sugar.
Okay.
So a lot of fat, salt and sugar is quite high on these processed food. And our taste buds are tuned to...
receptive.
Yeah. If you're completely... You go on a no sugar diet for 2 months, a little bit of sugar also kind of, makes you feel...
Stimulates you.
Yeah, it's so much. So, but, when you keep on conditioning yourself with more sugar, you kind of want it more. So, can uterus reveal gut health?
Yeah, I think we spoke about the axis.
Okay.
The estrogen, uterine, gut axis. Definitely it can.
One underrated anti-inflammatory food according to you?
I recently went to Korea where they eat that kimchi. Kimchi basically has cabbage. So I did a little research about it. Cabbage is a very good food.
For anti-inflammatory.
It's anti-inflammatory, low calorie, anti-carcinogenic, anti-tumorigenic, everything anti.
And it is
cabbage
fermented
is very
also,
good, fermented,
right?
exactly.
So mainly, I think that fermented foods are all the fermented foods.
Exactly.
Right? Like that's something which we are not, at least this kombucha and kimchi and all this become little popular because it's something from the West. Anything from India, our own buttermilk and, fermented kanjis. We are like a little bit...
Why should we have that?
Yeah, it's not so nice and cool. But at least something is imported, at least it is so more cooler to...
Cabbage
adopt.
is very good. It has a lot of polyphenols and all that.
Okay, nice.
So they're really good.
Biggest myth about women's cancers you want to bust?
All of them are hereditary. Only 15% are hereditary.
Again, yeah.
Rest 85% are acquired. So that is one of the reasons. And one more myth is that you have to take care of yourself. Things will not disappear by itself. Your health is more important. And only if you're healthy can you take care of your family.
Yeah, I think especially for women, no, they're who is the caregiver for a woman? Most of them, has always for everybody else, the child, there is a mother. For the husband, there is a mother. Or even, it's like for every other role, there is a woman caregiver all the time. But for a woman, for her, in a very competitive world today, unless she stops to really not run this race like a man or do things like a man and give importance to their own self-care, I think it becomes a toll on a woman's health, basically. So, one screening test you wish the government funded all women.
Ultrasound abdomen.
Okay. Talcum trauma, which has real cancer risk.
Talcum powder has been proven.
Proven. The others have also been, we don't know.
It's better not to use much chemicals. You have to use, but please use it sparingly.
If your patient delays biopsy by 3 months, can it change any outcome?
Yeah, definitely it can change because the cancer does not know what is the reason of the delay. Only thing it knows is that it has to keep growing and metastasizing. So if you delay it by 3 months, possible you may have initially a stage 1 disease to start with. It can become stage 3 or stage 4. So better not delay as far as cancer is concerned.
Even 3 months delay is very significant.
Anytime.
That's very important. That's why we wanted to emphasize that here, right? What's harder, catching cancer early or convincing them to get checked in women?
I feel convincing them is more difficult. Catching cancer is the easy part. Convincing them to come to the hospital, get checked, and even if they have cancer, to get treated, that itself is a big task. That's what we find in our OPs, in our general practice.
Because we really don't care about prevention, and unless something hits you, we really think we are so immortal.
True.
Right?
Yeah,
so
all of us for that matter.
All of us for that matter.
But one diagnosis of cancer it's life-changing.
No, for me, I'm telling you, as a gynecologist, like once I did casually ask a lot of other gynecologists, how many of them have done a PAP? It was strangely like almost, quite a significant number.
Have not
done.
Okay.
So, when I did my first PAP, I was like, I started making it a ritual every 3 years because I'm forcing myself to do it. It's not like so easy unless that much pressure I put to me, like go get it done. So unless this kind of thing happens, nobody's going to let's not just go. There's no time for it. There is for going and simply doing a test, why waste money? Many factors, laziness also again, just
this is the difference between us and the Western population, that they take screening very seriously. Yeah, because
preventive health as such is a very underrated, very less important place it plays actually in healthcare. That is a system flaw, I find.
Exactly.
Is family history of diabetes relevant to cancer risk?
Family history of diabetes is actually important because it actually correlates with hyperinsulinism, and that is actually again inflammatory and that can cause.
Yeah. Endometriosis is a risk factor for cancer.
Yeah, I've actually operated patients with endometriosis.
Okay.
One of the bulk of my patients are ladies who have endometriosis, and you should really see to believe during our laparoscopy and robotic. The area is so inflamed, and the uterus, bladder, rectum is all stuck to each other like a mass. You can obviously see it is so inflamed, and wherever there is inflammation, there is different hormones that are secreted.
Correct.
And all that will definitely give rise to cancer. And there is a direct correlation between endometriosis and uterine and ovarian cancer, especially ovarian cancer.
Because maybe there is an insult, right, which is we call see, ovulation itself is basically an insult. It's a trauma to the ovary, kind of. Then on top of it, we have these ovulation inductions, what we are subjecting sometimes, multiple cycles. There is a slight risk with very long-term fertility treatment with a lot of multiple cycles, especially not a couple of one or two, but a lot of cycles of ovulation. I've seen patients with 12 to 14 cycles clomiphene, then go for the letrozole, then come for all those injectables. So
feel sorry for
and
them.
Then that's what, by the time they come to IVF is the last thing they don't even come there directly, at least much earlier. They do, okay, let us try normally with tablets, and there is no limit to stop after a certain number of cycles. So this insult is very, very, it's happening in the system as such. They're exposed to a lot of ovulation induction multiple number of times.
I mean, it's an induced system by the system as such.
Because of the pressure to conceive. And, why wait and go into try taking an IUI or something, because they assume that is more a bigger procedure. This is a natural form of even from natural ovulation induction, IUI, then IVF. So here they find even IUI is a little bit, because they don't want to go there quickly. This normal trying is going for a very long time. They become frustrated, and because they choose the treatments. So that also could be more an insult to the
definitely.
Ovaries, and it can increase risk. Most underrated cancer prevention habit.
Most underrated cancer prevention habit. I think exercising.
Okay, nice.
Yeah, because what to say? How many ladies do we see jogging on the road or going to gym?
Yeah.
Hardly few.
Yeah.
I think if you take percentage wise, 5% maybe. And I feel obesity, exercising, weight loss, everything has a direct correlation with cancer.
Yeah.
Yeah. We need to exercise.
Two things like we can say, right? Like this exercise and good dietary fiber intake.
Exactly. Dietary fiber, definitely.
These two, I think, are real good preventive strategies for most of their health diseases. So I have a question because I see a lot of people use this supari, pan, men, women, everybody takes it. So are they cancer causing?
Yeah. Coming by personal experience. So before I was in Coimbatore, I was there for 4 years in Assam. So one of the most cancer dense regions in India is in Assam, because the reason is they take supari. Along with that, they take tobacco. What I've seen is kids as young as second standard, third standard, they start to take tobacco because of peer pressure. And the youngest kid whom I've operated for oral cavity cancer is around 12 years of age.
Oh my God.
So it is extremely cancer causing, and but ultimately the pressure comes not only from peer pressure. Even Bollywood actors whom we actually revere, they come for a lot of advertisements, which is basically something like surrogate advertisement. We think it's only kesari and all those, but actually they have tobacco in that.
Yeah. Sometimes they say even bida they add a little bit of...
bida they do.
Yeah.
What we call as 420 and all that.
Correct.
All of that have tobacco in that. It gives you an instant high and it suppresses your appetite also. So poor people take that. Instead of eating, they take that and they continue their work.
They are proven carcinogens,
exactly.
Right?
They're the most common cause of carcinogens in India.
Especially this oral cavity.
Especially oral cavity, esophagus cancer, food pipe, stomach. All those are caused by that. Bladder. Almost 30 to 40 varieties of cancers are caused by tobacco.
I think we had a very interesting and fruitful conversation around the cancers, the commonest cancers which are affecting women today.
I learned a lot too, thanks to you.
Oh my God. So I'm so happy to have you in our Feminine Systems podcast.
Thank you,
Dr. Praveen.
Thank you.